Hi, Dr. Marlene Mireles, physical therapist here for your Pediatric Telehealth Coffee Hour. And today we're going to be interviewing Dr. Katie Gatica, physical therapist. And she's actually from Alaska, and she's been practicing telehealth since 2015. And she also teaches other therapists how to do the same and how to master telehealth. So we're going to talk about that, and she agreed to come on today to share some tips with us. So thank you so much for joining us today, Katie. I wanted to know, how did you get into telehealth?
Out of necessity. So, since 2015, I started working in the school district. I was doing some contracting for the school district. And in Alaska, I'm in like a kind of semi-rural area of Alaska, where the school district probably had maybe like 60 different schools. And I had half of those, and they were all really spread out. And some of them were only accessible by boat or plane. So some of those schools were off the road system. Some of those schools that were on the road system were still pretty inaccessible during the winter, unless you had a snowmobile or a four-wheeler. So I had several kids that, I would try to visit them physically when I could, but with unpredictable weather and things like that, there were many occasions where I physically was not able to make it to do my treatment sessions with those kids. So we did Skype sessions. So I was doing it for school. That was my first exposure to that. There was definitely a learning curve, but so I did that for the school system for like 4 years. I've since started my own practice. I'm still in Alaska. I still serve clients who are really far away. So I'm doing telehealth for them. I also am still doing some contracting for like a pediatric clinic that's in a town that's 4 hours away from me. So I'm still doing that. So there's a little mix of everything in there.
That's so awesome. And I'm so happy that you're here to share with us, since a lot of us just started doing telehealth because of the pandemic. And again, we were forced to, and I think everybody's just, it's so new that we have the skills, we just don't know how to communicate sometimes through this new platform. So can you tell me an example of how you have empowered a family to be more involved and motivated to participate during a telehealth session?
Yeah, so family empowerment is something that I think telehealth has brought as a blessing in disguise, to be honest. I mean, telehealth isn't my favorite thing. I'd definitely rather be treating a kid in person because it's way more fun to be playing with kids for my job, right? And when you're on the computer, you're not actually playing with the child so much. But I think in telehealth, it's really forcing us as therapists and forcing parents to really look at it more from the perspective of the parent is the child's primary caregiver, and they're the one responsible for them achieving their goals. So when you're having to deliver this through telehealth, we're almost forcing that on the parent to step up to the plate, really, in their responsibility in helping their child achieve their goals. And us as therapists are having to find a way to kind of step back and step down from that a little bit and really coach them to be the one who's responsible for that, right? So, I mean, in my practice in general, even telehealth aside, it's something that I really focus on as far as being family-centered. When I am evaluating a kid, the first conversation that we have with the parent is what they're concerned about, what they care about, what their goals are for their child, and what they want me to help them with. That's something that I really like to emphasize. Again, just knowing that caregiver involvement really, I mean, there's evidence showing that kids get better results the more involved and consistent and skilled their caregivers or their parents are. So that's something I really emphasize anyway, even if I'm doing in-person visits. So that's like the first conversation that we have is, what are your goals? And then it really becomes a matter of focusing everything that you do and everything that you talk about on those goals and bringing it back always to what the parent really cares about, right? So when I've had parents who are, sometimes you get those parents who are just like on it and really involved and really enthusiastic, and that's amazing and really easy. But when you have those parents who, just are less enthusiastic, a little hesitant to get their feet wet, then it just becomes a matter of, first of all, like finding out where they're coming from, like what they're feeling and what they're experiencing, and then kind of addressing that and helping them overcome that. So, I've had, and it's always about like asking questions, right? Like asking, if you're in this telehealth session and you see that the parent is struggling to either like be attentive to their child or struggling to like just follow along with you, it really becomes a conversation of like how are you feeling with this right now? Like what's going on in your head, and what can I help you with, and understanding how they're feeling. So when when a parent isn't really stepping up, I find that when I ask those questions, rarely is it that they don't care. Like rarely is it that they don't care about their child, or like, I don't care about therapy, I don't want to do this. I've never had a parent say that, right? I do have parents. Sorry, what?
Have you ever had to help a parent by referring them to like get outside counseling for themselves if they're going through any type of depression, or if like right now we're going through a pandemic, so a lot of families are having a lot of emotional things going on, but I don't know how it was before the pandemic, but have you ever had to like, if the parent asked for it or if they made it known that they were having, extreme depression, have you ever referred them for them?
Yeah, I mean, yeah, we'll have that conversation. Like if there's something serious going on, it's more me just saying like have you sought help for this? And do you want help seeking help for that? I have had a couple of cases of that. And again, it's just like, hey, let's support you in getting the resources that you need.
And then I know when I do interviews, I like to kind of send like a questions that I'm going to ask, but this one just kind of popped in, and I'm sure you've popped in my head, and I'm sure that you came across this a lot. I had a friend of mine message me the other day, and she sees a patient, but he also has a lot of siblings, so they're all there during the session. So she said that it's hard because she's trying to like, and most of them have, like, one has autism, they have other stuff going on with the other kids, so the mom's kind of all over the place and trying to do the telehealth session. So how do you navigate that type of situation?
Yeah, for sure. That comes up a lot. And I mean, that can be really challenging. But often it's a matter of like seeing what the issue is and then problem solving with the parent as best you can. They have, other kids, mom's alone, and there's 5 other kids running around and they're not able to focus. Then, we say, will they sit in front of a movie for the next 30 minutes? Play on a device. I'm not a proponent of like a lot of screen time, but if it's a matter of getting those kids corralled and focused on something else so that we can do our telehealth session,
that's a good idea.
You find what works, give them a snack. I've even had siblings get involved with the therapy session. Not all kids are like appropriate for that and will cooperate with that. But if they're older siblings and they are pretty cooperative, sometimes it's like, hey, let's make this a group game. And it's still, therapy focused on the child, but then the other siblings are involved, and we're all at least all in one space and focused on one thing. And that way mom can focus on that one thing instead of 5 different directions. So
It's true. And then another question, so I can even think of, there's a situation we just talked about, and I'm sure there's other ones where maybe the parent or the child becomes frustrated because they don't understand what you want them to do, or the parent is frustrated with the child because they're not doing what she wants. What are some things that you will provide to the parent or child to help, get everything going on back to where it should be?
yeah, absolutely. I mean, if you see that frustration is starting to like boil up, I always like to take a break, switch gears. If it's because the kid is not focused on the task, or the kid is getting frustrated because the task is too hard, whatever that is, I say like, okay, let's just take a break. Let's switch gears for a second. Let's do something fun. Let's do a wiggle break. Let's do some yoga, some deep breathing, dance to a fun song, whatever is going to be like refreshing for them.
Right.
But when there's frustration either on the parent's part or the child's part, for me, like there's this analytical process that I go through. You have to find the root of the frustration. You need to find out the why, and address that. Like just taking a break and then going back to what you were doing, the exact same thing before, is not going to work because something was wrong with what you were doing before. So you have to think about what both an adult and a child need in order to be, in a state of like being able to attend to a task, engage, and be learning, and there's kind of like 4 different things that they really need. They need to be comfortable and secure. They need to feel like they're in a secure and comfortable place, that they're not in danger, that they're not out of control. They need to be regulated emotionally and in a sensory sense as well. So they need to be like in a state of calm. They need to be able to pay attention to the task, and the task needs to be meaningful to them. Like they have to be interested in it, right? So, I mean, a breakdown can happen in any one of those areas, either for the adult or the child. So, maybe the adult is frustrated because the adult is finding that what I'm asking them to do is too hard. Maybe I'm asking them to do too many things with their hands and too many cues, and trying to get the kid, where it's just overwhelming for the adult. And that's just their sense of like, this task is beyond my capacity. And that's definitely a feeling of like discomfort and not a feeling of security, right? Or the same thing can happen to the child. So you're looking at like, is the task too difficult? Are they perceiving that the task is too difficult? Are they getting frustrated with the task itself because it's just too hard? Or if you're looking at like emotional and sensory regulation, you're looking at that, like, are they just, like out of control emotionally? Is there a sensory need? Like, hopefully we know the child well enough to know if there are like sensory processing issues going on, and knowing what kind of sensory breaks they may need, some kind of sensory like organizing activity. So, if that's a strategy that you would be using, regardless of telehealth, like that's something that we should be using with our kiddos anyway, then using that tool and say like, okay, we're going to do some like deep pressure, whatever, pillow squishes, whatever, if we know that that's something that works for that child.
Do you, talking about, because I know you said sometimes if a parent feels overwhelmed if you're asking them to do too much stuff with their hands. So when you do have to teach a complex task that a child, maybe a lower level child, like really needs, and the parent does need to do some complicated hand movements, what do you do to prepare them for that prior or during? Like, what are some strategies that you use?
Yeah, if there's something that I know I want to do that's a little more complicated, and I'm preparing ahead of time for that, I definitely start simple. Like if it's something that requires like 5 different things for the parent to think about, the first time that we try it, I definitely like break down the task and break it down to its simplest form. So let's say, for example, that we're working with a kid with poor postural control. And what I want them to do is be able to like sit them on a ball or a stool, and they have to sit behind them and support them with their legs, and then they have to support them at their trunk. And I want to be doing like some reaching and some weight shifting, like reach over for an object and then put it in a box in front of them. And what the parent, what I would normally do is use my body to support them. I'm using my hands for like tactile cues. I'm using my hands to like guide the weight shift, and also physically help their arm. Maybe they have like upper extremity weakness, and guiding all of that and giving verbal cues. So that's something that like, that's an activity that I want to do with that kid. I don't start out with the parent trying to do all of that. I just start out with a parent trying to practice sitting. Mm-hmm. Like that's what we're going to start with. I'm going to teach the parent how to sit the child on whatever, the chair in front of them, or a stool, or maybe they're crisscross on the floor. And I teach the parent how to just sit behind them, and like, here, you're going to put your hands on their waist. And this is what we're doing. And I'll give like the visual demonstration, like I'll show it, with a doll or whatever, so that they can see it. I'm obviously giving those like descriptive verbal cues. And we're just focusing on that one task. And I'm talking about what they should also be feeling and looking for. That child starts to lose his balance, and you feel that they're starting to lean over to one side, that you're guiding them back to the middle, things like that. And then you build on it from there. So maybe that's all you do for that first session. And then the next session, you practice that same skill again. But then you add on like, okay, we're just going to practice guiding him in some weight shifting, and then maybe the next session, we talk about the reaching and all of that. You want to think about their learning style as well. And sometimes that's enough, like just to do the live video. But sometimes parents need a little more, like other resources. Maybe they're a visual learner and they really do well with pictures. So I'll send them pictures, send them a handout. Videos, there's a lot of really great videos on YouTube. So I'll just go find them a video, or maybe like a link on a website, and send that to them beforehand, just so at least they can see it and see this is what we're going to be doing. Be familiar with that before I just surprise them with it in the next session.
So I know, and that kind of goes into, we had a question from, let's see, I have it on here, Nicole Garcia from the Pediatric PT SLP OT, the long name, right? Telehealth
group.
The group. She had asked, how do you get kids with significant strength limitations to engage in fun motor skills via telehealth platform? So what are some, how do you make it fun for kids that are lower level?
Yeah, I get that question a lot. Like, what do you do? Like, what activities do you do? And my question back to people is, well, what would you be doing in person? And I think where a lot of therapists struggle is just knowing like how to translate the activities that they would be doing normally, like into a telehealth session. And honestly, I'm doing like the same stuff. You're just delivering it in a different way. So, again, if we're talking about like maybe this kid with muscular dystrophy who has significant strength limitations, and you're trying to get to work on core strength and you're trying to make it fun. Again, I'm just thinking about what I would be doing. Like I'd have him on a ball, I'd have him playing Foursquare or something, right? Like reaching, weight shifting, grabbing the checker and putting it in the game. And then you just have to think about how you can modify that to work at home, and also to work for, the parents to do that with you just coaching them through that. And thinking about modifications, obviously, like if they don't have a stability ball at home, right, and just thinking about modifications as far as equipment goes, we can get creative and make a lot of homemade things, but maybe it's just they're like on a chair and they're on like a soft cushion to give them a little instability or something. And if you don't have that exact game, then find another game that they have at home, if they have puzzles, or maybe you're just having a pencil and paper and you're just playing tic-tac-toe. You're reaching over this way, grabbing the pencil, moving forward, marking the mark. All right, so that would be my suggestion, is like, think about what you would be doing normally to make things fun in person, and then just how are you going to modify that to work at home and coach the parent through that.
And then I know I feel like you did demonstrate some of the verbiage that you would use with the parent, but we had also talked about maybe doing, like, if you could model some verbiage and maybe demonstration with the doll, if you were, like, how you would describe it and try to portray what you wanted the child or parent to do. So I know you mentioned sometimes you do like holding techniques with your doll to show the parent. So can you just kind of pretend like you're talking to me and I'm, mom, and how you would talk to me and describe something?
Yeah, sure. I do have my doll. And I'm going to shift my computer a little bit here. So, it might be, the doll's easy when we're working with babies, obviously. So maybe it's something where we just want to work on sitting. Let me prop him up here. This is my home office, my bedroom.
I'm in my bedroom too.
Yeah. Yeah. I'm also very pregnant, so it's really hard for me to move around. But this is my proverbial lap, right? So maybe it's just an infant who's a little delayed, and we're just working on sitting, for example. So I'm trying to teach the parent that this is how we hold the baby. So I'd say, like, let's put baby on your lap, or let's put baby on the floor in front of you, and your legs are out on either side, and your hands are going to be on his waist. Your hands are going to be on his waist and maybe just like right above his hips. Okay. And his legs should be straight out in front of you. And we're going to work on some balance reactions to really work on his core strength. So all that you're going to do is, and actually you're going to put one hand kind of under his left hip, and you're just going to lift that left hip a little bit so that he's leaning over to the right. And you also, so we're going to just go back and forth. Going to lift that one hip, bring him back to the center, make sure he's balanced, and then put your hand on their other hip, and we're going to lean him the other way. Okay, and then I'm also going to talk about like what they're looking for. So we're going to lean baby to the right as far as he can go, while he's still able to keep his head either in line with his body, or he should be tilting his head upright, so that he's still vertical. We're going to push into that limit, and if we start seeing baby's head fall, then we want to back off a little bit, so we don't want to go that far. So we're just going to practice together a couple times. Let's go this way, and I'm watching mom do this with baby, and I'm also able to see that we're leaning too far, baby's totally losing head control, and I can say, like, okay, that was a little too far, let's not go that far next time, and we just give that feedback.
Yeah. And so a lot of times, like exercises we do on babies, we might also do on an older kid that's bigger, that's at a lower level like that. So do you ever, when you have an older kid, do you use the baby doll to demonstrate, or do you have larger dolls? Or
I don't have larger dolls, so I do it with my baby doll, and just try to simulate as best I can. Again, if they're like a really big kid and it's just not going to make sense with a baby doll, I do look for a video. I know that I haven't done this myself. I know that some therapists have used their own children to try and make a video, their own like private video, and then send it off for the parent to view beforehand. Okay. And that as a parent, that's your choice.
Yeah.
And if you have a child that's cooperative enough for that to work, then,
Yeah.
then that can be an idea too.
Good.
So.
I love that demonstration. I thought that was really good. And I think it's going to give a lot of therapists, like, especially if they haven't started telehealth yet, to help them feel more comfortable. So let me see what other questions that we had here. All right. So what are the top 5 tips that you've learned since doing therapy, telehealth therapy, that you want to give our audience to have a successful session?
Absolutely. I wrote these down because you did ask me these before. About 5 would be too many for me to remember with my mom brain. Yeah, so tip number 1 is preparation. A little preparation goes a long way. And I find that the more prepared I am as far as my game plan and what I want to do, and how well I've prepared the parent or the caregiver with that game plan so that they know what's going on too and we're on the same page, the smoother it goes. I find if I haven't planned and I feel like us as therapists generally are pretty comfortable just kind of going into it and figuring out as we go along. We haven't planned every detail of our session and that works for us when we're in control and no one else is needing to drive the bus with us.
Right.
But when you're trying to do that with a parent and you're just surprising them every 2 minutes and they don't know what the next activity is, that can be very unsettling, and that can feel like that they're in an uncomfortable place and that they're out of control. And that's not where we want our parents to be. We want them to feel comfortable, like they know what's going on. And also, understanding that they play such an important role in helping their child reach their goals and that they truly are an equal team member with you, to be aware of that and to support them in that. That might be my point number 2 is like the parent coaching model is the way to go with pediatrics, right? And just understanding how to make them an equal player and for you guys to be co-directing this session. And not only to just prepare them and let them know what's happening, but also to involve them in that process. Again, going back to what their goals are and what's important to them and what they want to work on, and focusing your plan on that. And also, knowing where they're coming from and being empathetic and really showing that you're supporting them as opposed to the other way around. Like, you're there to support them and them helping their child achieve their goals, not the other way around. They're not there to support you and just be your minion. So don't treat them that way, right? That would be my point number 2. Okay, tip number 3 is check your tech.
Yeah.
That's really important. Because if you have bad tech, you have a bad internet connection, you're freezing, the screen is blurry, you can't see what's going on, you just can't really run a session like that. So again, a little preparation goes a long way in helping the parents to check their tech and just know how to have a good internet connection, turn off other streaming services and the device and how you're going to set up the device and things like that.
Do you use a backup platform because I know sometimes I've had parents where it works fine we've done a few sessions and then one session all of a sudden I can't hear them. Do you use a backup platform, especially since right now there's a lot of other platforms that offer, or do you just kind of brainstorm with the tech that you're on or the platform that you're on?
Yeah, I haven't really had to go to a backup platform. I use doxy.me, and it's been working well. I've also used Teams. I've mostly used Teams with that clinic that I'm contracting with. Otherwise, you need an account for each of your patients that you're working with. If there's technical issues, we try to troubleshoot. I always have their phone number on hand so that if we do get disconnected or something's going wrong, I can just call them. Yeah, I've had where they just couldn't figure out how to unmute themselves, or they couldn't figure out how to like switch the camera on their phone or whatever. So I'm on the phone, like kind of helping walk them through that. That's usually what I do.
Good. And I think that was number 2, right?
That was number 3. Check your tech. Number 4 would just be to be creative with like your equipment and your tools. Again, knowing that in a clinic you usually have lots of fun equipment options, and that just being able to look at the patient's home and being resourceful and creative with what they have available there, and trying to, you know, kind of recreate what you want as much as possible. You know, maybe they don't have toys like rattles or like bean bags. You can make those out of like beans or rice in a Tupperware thing, or like in a Ziploc bag. You want to work on throwing into a basket, but they don't have balls. You can use like rolled up sock balls and a cardboard box, right? So, and again, I think that is kind of a sticking point for a lot of therapists. Like, I can't use my hands and I can't use my equipment. How am I going to make this work? And it's like, we're creative. You can figure it out and just come up with like a homemade version of what you want.
Right.
And my tip number 5 is to trust yourself. Again, we're all skilled clinicians, and you know, we know what we want to work on, and we know how we want to work on that. And I think, yeah, I think a lot of therapists just have a little trouble like trusting their clinical judgment and their clinical skill because they can't use their hands. Right. And it's like, it's all in there. You just need to deliver it a little differently. You just need to use your words more than your hands. Mm-hmm. And you know, trust your intuition, trust your clinical judgment. And for those who haven't dived in yet, to just dive in and just try it. And I think it's not as hard as a lot of us think it is.
When I dived in, it helped that all of my patients right now, I used to see them in person, so I knew them. So I haven't had a new patient yet that I haven't seen. So that will be, you know, interesting when I haven't actually had a chance to build that rapport.
Yeah.
So let's go ahead and go into some business questions, because we do have some therapists on here that own their own business or they're interested in starting their own business. So I know we talked about how before the pandemic that your business was part telehealth, part face-to-face. So how was the transition going to 100% telehealth? Did everybody understand?
Yeah, it went really well. I mean, we kind of had that conversation as far as like, this is our only option now. Yeah. And I've had all of them transition. All of my private clients have transitioned easily into telehealth. I did have a couple of families from like the clinic that I was serving opt out of that. And again, I just think that that's because of that lack of, not like total lack of relationship, but just the relationship with those parents who were bringing their kids into a clinic is different than those where I was going to their home. Yeah. Like you were saying before, where in like you've already established a relationship there, makes things easier. So yeah, for those that I had that relationship, it was easy to just transition over.
Have you gotten any new patients since that have started off like straight into telehealth during the pandemic? And when you talk to them about telehealth, how do you sell it? Like, how do you make them want to, be more on board with telehealth if they're not on board to it or are hesitant? I know it's their only option, so if they want their kid to get therapy right now, but if they're kind of hesitant about it, what do you tell them to convince them?
I think my most convincing words are, let's just try it. Yeah. And see how it goes. They have nothing to lose by trying a session.
Right.
I mean, I do offer like free consults before I do like a full-on evaluation that we can do through telehealth. And they can see, if that's the first interaction that we have, then that's my opportunity to like show them how it works and show them that we can still have this quality therapeutic interaction. Otherwise I've spoken with people on the phone, who I've gotten a referral and we're like, hey, let's schedule. We have to schedule through telehealth. And I explained to them like how telehealth works and what it looks like, and still definitely making a point to explain that it's still therapy. You're still going to get the same quality of therapy that I would be giving you in person otherwise. And also kind of like upplaying that whole parent empowerment piece too. Like, this is going to give me an opportunity to really teach you the skills that you need to help your child accomplish these goals. And you're not going to depend on just depend on me just because I'm the therapist and you're not, right? So we talk about those things. And again, I always like to talk about their goals and what's important to them, and bring it back to like, well, this is how I can help you help your child do this through telehealth.
Right. And it's the only option right now too. So it's like
yeah.
So,
and they could opt to not do it and wait, but then there's the conversation of like, well, how long is this going to last?
Right.
And what's going to be the consequence of your kid not getting therapy for weeks, months, who knows, right?
I know a lot of the families that did opt out with my contract job, now the company's reaching back out because they didn't know how long this was going to last then, but now it's a little bit longer, so they're reaching back out to be like, well, do you want it now? Because, so I know you have a course that you're doing for therapists, and is it for just physical therapists or like all therapists?
It's for OTs as well.
Okay.
I have a current class going on now live, and it's mostly PTs. I do have a few OTs, pediatric OTs who are going through it, and again, we're talking about strategies, kind of like we've been talking about today, that are still applicable. Like, I don't necessarily have really specific activity ideas for OTs, but again, it's just, we talk about those strategies about how to apply what you want to use clinically on a telehealth platform.
How long is the course?
So it's 8 weeks. It's an 8-week live course, and the next class starts on April 27th, which is Monday. And there's at least one like hour-long training each week. Some weeks have like 2. So every week you're getting a training, and we cover everything from the very exciting like HIPAA and legal stuff, just how to be protect yourself legally and get all of your tech set up, and then we dive into the kind of more the clinical aspects. So we spend a lot of time on the parent and caregiver trainings, how to prepare for like your first session. If your first session with your first interaction with a patient is on telehealth, like how to make that be the best kind of experience. And then of course like the treatment ideas and techniques and all of that stuff. We're even going to talk a little bit about like marketing your telehealth services.
And so that was one of the other questions that I had listed, was how you're marketing your services now.
Yeah, I mean, kind of a variety of ways. I do a lot of social media. I'm fortunate to live in a place where basically the whole community is on Facebook. So like social media, I also do a lot of community like services. So like classes and seminars and things like that, like free events that again, that normally I like to do in person, but now I'm doing them online, that a lot of people are interested in and attend.
So in your course, you all talk about how to dive deeper into that marketing aspect.
Yeah. We're going to have a training on marketing.
So the next class starts on the 27th, and then for the group, you are offering a discount, right? Can you tell them more about the price and the discount, and if there's anything else that you wanted to add about the course.
Sure. Yeah. I would also add that there's a live component to it where we're going to have live Q&A sessions
Okay.
on Fridays. So people can come in with the actual struggles that they're having, and I can help them with that. So yeah, it's like this 8-week really intensive program, and I'm putting in like everything that I know and have experience with telehealth in there. Starts April 27th. It'll run for 8 weeks. The cost is $197, which I think is a total deal.
Definitely.
Of like, you're gonna get like hours and hours of training if you think about how much you would spend. So like, it's probably gonna be like 20 hours of like Zoom video training, if not more. And if you think how much you would pay for like a continuing education class, that much. Plus the live mentorship program. So the discount is 20% off. And when you go to the checkout, it's TELE20, TELE 20.
Okay.
We can do like group discounts as well. Again, in my current class, I've had a couple groups that are just all the therapists in the clinic. There were 12 of them and they all wanted to come in, and so I do group discounts as well.
But if they're already getting the 20% discount, would they still get a group discount, or since they're getting the 20%?
The group discount's more than 20%.
Okay.
Yeah. So
what is a group, like 3 or 2 or?
More than one.
Okay.
Yeah.
Okay.
Yeah. I mean, it depends on, this is why I say just contact me, because it depends on the group size, and it depends on if you're a for-profit or a nonprofit organization.
Okay.
The discount will be different. So.
And then I think you've definitely shown us with your experience and your answers on why somebody should invest in your course. I know that's one of the questions that I had listed, so I wanted you to be able to say what you had planned to on why someone should invest in your course.
Yeah, I mean, I just think it's you're going to come out the other end feeling like completely confident as like a master telehealth provider. If you're someone that is going into this or just starting with it and still feeling like you're not knowing what you're doing, or feeling like you're not able to give like the quality care that you want to give, this course is going to help you get out on the other side of that, being like a really masterful virtual therapist and being able to give your patients what they really, really need.
And then I know we posted the link to the group, and we can post it again. And when they click on it, will they also be able to see kind of like an outline of what they'll learn? If they want to, if they're like on the fence, they can see what the, I guess what your syllabus or,
Like the curriculum. Yeah. Yeah. The website, goes over, provides all of those details, as far as like the topics of trainings, and the schedule and things like that.
Okay, good.
On that website.
Okay, and is there any other information that you want to share with us? I know I have one last question, but I wanted to give you an opportunity to share anything else that you wanted to share.
I don't know. Just, I think all of us are getting into telehealth by necessity, kind of in trial by fire right now. But to be honest, I mean, telehealth has been around for a long time. I've been doing it for 5 years. Other therapists have been doing this even longer. And I think that it is, in a way, the way of the future. Not that like telehealth is going to replace therapy, but I think even after all this is all over, telehealth is going to have a very solid position as like an adjunct to what we're doing in person, and just going to make quality of patient care even better, just for the access and the continuity and being able to, like, even if it's just for check-ins and things like that.
Right, definitely.
So something worthwhile, not just for the state of emergency, but something that is worthwhile to do and for the future.
I think we had a great interview today, and we got a lot of great tips and strategies. And then since this is the coffee hour, even though we're doing it, I'm not drinking coffee this late, and I doubt you are. But how do you drink? Do you drink coffee?
I don't drink coffee.
What do you drink?
Water.
Okay. So how do you drink your water? Do you use lemon?
In a bottle.
Okay, good. Well,
Yeah.
I had a lot of fun during this interview, and thank you so much for coming on today.
Yeah, I had fun too. Thanks for doing this, Marlene.
Yeah, definitely. Let me go ahead and stop recording, and then we can chat a little bit. 1 second.